Welcome to my channel. After missing a menstrual period, a urine test is done to determine if pregnancy has occurred. If pregnancy occurs, Alhamdulillah, the urine test will be positive and the pregnancy symptom will also start to appear. After that, the first ultrasound is done at the doctor chamber. Sometimes the ultrasound report states gestational sac but no fetal pool. In some reports, it say no yolk sac, meaning there is a pregnancy sac but no fetus inside the gestational sac. Sometimes it show no fetal heartbeat or fetal heartbeat not present, which means the baby's heartbeat is not detected. Hearing faces like there is a pregnancy sac but no baby or baby's heartbeat is not present take away all the joy and start period of anxiety. Question arise in the mind, is this really a pregnancy or not, or has it resulted in a miscarriage? So in today's video I will discuss with you when an ultrasound report might show no fetal pool or no fetal heartbeat. What does this mean? What should we do in this situation? So let's get started. First, we need to understand some basic concept. When intercourse happens during ovulation, the male sperm meets the female eggs, creating an initial cell. This cell then attaches to the inner lining of the uterus called endometrium in a process known as implantation. After implanting in the uterus, the first structure formed is the gestational sac. Inside his gestational sac, the cell continues to grow. The embryo with the gestational sac is referred to as the fetal pool. The fetal pool gradually grows and developing into a baby. So, we now understand that what is the gestational sac and fetal pool are. From ovulation to transformation of a single cell into a baby, this process occurs in several stages. It is very important to remember the date of your last menstrual period before pregnancy because the age of pregnancy is calculated from this date. Typically, if you are pregnant, a urine test will show positive result 1 week after missing your period and pregnancy symptom will begin to appear. At this point, the pregnancy is about 5 weeks along. At 5 weeks of pregnancy, only the gestational sac is formed in the uterus. So, if you have an ultrasound at this time, the report will show gestational sac, no fetal pool is seen because the fetal pool has not yet developed. In some cases, nothing may be visible on the ultrasound at this stage, not even the gestational sac. This is more clearly understood through transvaginal sonography or TBS than an abdominal ultrasound because TBS can detect things earlier and more clearly. At 5 weeks of pregnancy, only the gestational sac can be seen and sign the fetal pool has not formed yet. It won't be visible. Between the 5 to 6 weeks of pregnancy, an ultrasound typically shows the gestational sac and yolk sac but no fetal pool. After the gestational sac forms, a ring-like cycle called the yolk sac developed. The fetal pool forms after the yolk sac. When an ultrasound is performed around 6 weeks, both the gestational sac and fetal pool should be visible. The ultrasound report will show CRL, meaning that crown rump length, which is the measurement of the embryo's growth. Up to 3 months of pregnancy, the size of the embryo is measured using CRL. At this stage, the report might say no cardiac activity seen or fetal heart rate absent, meaning the baby's heartbeat has not been detected yet. Generally, the baby's heartbeat is detectable between 8 to 12 weeks of pregnancy. If you have an ultrasound at 6 to 7 weeks, it is normal not to see the heartbeat. In some cases, the heartbeat may be detected as early as 7 weeks. Thus, having an ultrasound might result in a report showing no fetal pool, no yolk sac, or no fetal heartbeat. What should we do in this situation? There is nothing to do except be patient. Your doctor may prescribe progesterone hormone medication based on your ultrasound report. Take this medication and have another ultrasound after 2 weeks. By then everything will be fine inshallah. But in some cases, even after 2 weeks, the fetal heartbeat cannot be detected by ultrasonography. Therefore, in some cases, the fetal heartbeat cannot be detected even at 9 to 10 weeks of pregnancy. This could happen for various reasons. Often, the calculation of pregnancy age based on your last menstrual cycle may not be accurate, especially for those with irregular menstrual cycles or a 35 to 38 days cycle. Based on the date of your last menstrual period, you might calculate that you are around 8 to 9 weeks of pregnant. However, it is possible that conception occurred later than expected, meaning that the actual gestational age could be around 5 weeks. In such scenario, it is advisable to patiently wait for another 2 weeks and then repeat the ultrasonography. Because if one ultrasound does not detect the fetal heartbeat, it cannot be concluded that there is no baby in your womb or that is a miscarriage has occurred. If the fetal pool is not visible or if the baby's heartbeat is not detected in the first ultrasound, it is not a case for concern. In most cases, a normal report can be obtained if your ultrasound is performed 2 weeks later. However, in some cases where the heartbeat is still not detected at 10 to 12 weeks and the baby's growth is not progressing, it is termed a blighted ovum or missed miscarriage. This can be verified in a couple of ways. Typically, a miscarriage is determined based on two features in the ultrasound report. Number 1, if your ultrasound report shows a gestational sac diameter, also called G-sac diameter or GSD, and it's more than 25 mm but no fetal pool is visible, it can be said that a miscarriage has occurred or a normal pregnancy is unlikely. Until your G-sac diameter reaches 25 mm, you can wait as there is still possibility of a normal pregnancy. Have another ultrasound after 2 weeks to check for further development. Number 2, if your ultrasound report shows that the crown rump length or CRL is 7 mm or more but there is no fetal heartbeat, it can be confirmed that it is miscarriage. Until your ultrasound report shows the CRL of less than 7 mm, there is still possibility of a normal pregnancy. Wait for 2 weeks and have another ultrasound. Therefore, if no fetal pool, no yolk sac or no fetal heartbeat are seen on the ultrasound, please be patient and repeat ultrasound after 2 weeks. Number 2, keep an eye on the G-sac diameter and CRL in your ultrasound report to see if they are increasing. Number 3, if there is no heartbeat within 12 weeks of pregnancy or after the CRL reaches 7 mm, it is indicate a miscarriage. Then it is necessary to follow the doctor advice and terminate the pregnancy. So, I hope today's video was helpful for you. If you find the video helpful, do not forget to share it with your friends. Please subscribe to the channel to get health advice, health awareness and reproductive health related all the videos, and remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.